Hello there. I'm Anna Marie De La Vega. Thank you for joining us for Focus. Today, we're going to talk about an issue that so many people struggle with. It's weight loss, obesity, illnesses that are related to that. And every so often, a couple of times a year, we become obsessed with ways to lose weight. So maybe it's time to turn to an expert. That's what we've done today. We have Dr. Stephen Rich. He is an experienced general surgeon and bariatric surgeon with Ascension St. Thomas in Murfreesboro, board certified in general surgery. And first of all, welcome.
Thank you very much. Thanks for having me.
That sounds like every woman's dream. Dr. Rich.
It's false advertising.
He has a special interest in treating individuals who are suffering from the disease of obesity. That's what you said specifically, the disease of obesity.
Obesity is certainly a disease. I think a lot of times even healthcare professionals sort of miss the mark sometimes because we don't treat it as a disease. You know, when I see patients, they'll have a list of their medical problems. They'll have high blood pressure. They'll have diabetes. They'll have all these other medical problems, but they won't have obesity or morbid obesity on the list of their medical problems. And the truth of the matter is, it is a disease. The unfortunate thing is it's undertreated. And if we treat the obesity, then it might alleviate that individual's other disease processes like high blood pressure, diabetes, hyperlipidemia, long list of diseases.
So that's part of why you say obesity should be treated as one of the medical problems, one of the medical issues that they have.
I think it's overlooked, and I think one reason why that it's overlooked is it's a hard conversation to have.
Yeah.
You know, you have the primary care doctors, they'll might in passing mention, hey, you need to lose weight, you know, and then just leave it at that.
Yeah.
Well, just a recommendation like that without any guidance on how to do that is really not really helping the patient out.
Yeah.
And so I think that if we can come to grips with obesity being a disease, we can look at it as a disease process and not as a personality defect or, hey, this individual must be lazy or just doesn't, you know, exercise, doesn't eat right, and that sort of thing.
There is a lot of shame and a lot of embarrassment, and even talking about being overweight. We want to hide it from people. We want to not talk about it. And if the doctor says, how much do you weigh? And you don't have to get on that scale. You're like, I'm 20 pounds less than what I really do.
Yeah, a lot of times it is underestimated because we don't want to face it ourselves.
Yeah.
Because of the shame that comes along with it. And, you know, our bodies also affect our mental state. And if we don't feel good about ourselves, then it just sort of becomes a downward spiral. We don't want to address it. We don't want to look in the mirror and say, hey, I have a problem and I need to address this problem.
Instead, we look in the mirror and say, hey, I am faulty or I am broken and there's something wrong with me. Not like I have a problem and I can address the problem.
That's exactly right. You know, I have a lot of patients that when I talk to them for the first time about in the consultation for bariatric surgery or weight loss surgery, you know, one of the first things that I tell people is, hey, you know, we use terms like obesity, morbid obesity. Unfortunately, in our society, sometimes those are used as derogatory terms.
Yeah.
You know, sort of as slurs.
Oh, yeah.
But we use it as a medical term to describe a medical condition. Even when I'm talking with people, a lot of times you can see that they have sort of a wall that's placed up. They don't really want to talk about it.
Yeah.
But then when we get into counseling them and saying, well, here's what your options are and really explaining it to them, you can kind of see them kind of tearing that wall down. And even sometimes people, when they describe their experience in life, going through life, some people, they cannot remember a time that they weren't in the obese category. And then they almost, you know, a lot of times people will tear up.
I was about to ask that.
It's a very emotional thing.
Yes, because you feel so much shame and you want to hide. And it's letting that vulnerability, being vulnerable with someone like you, a healthcare professional, a surgeon who you know what you're talking about, and you're not shaming them. You're not saying, well, we'll just get you doing this and you're going to lose 20 pounds by the end of the month.
And one of the reasons why I have that conversation with people is, you know, we're all on the same team. You know, our bariatric center, we're all on the same team, and we all have the same goal as the patient, to treat this disease and get people in a position to where they can enjoy life, be healthier, not have to compromise the things that they want to do.
Yeah.
I think there are a lot of things that maybe people that don't have the disease process of obesity, they don't really understand. They think, well, these little things like riding a roller coaster or being able to go on a hike with their family.
Yeah.
Or being able to get on an airplane without asking for a seatbelt extender. I had a patient that came for a follow-up visit. She was crossing her legs, and she was about a year and a half out from surgery, and she'd had excellent weight loss. And she goes, the other day I looked down and I was crossing my legs. She goes, I can't remember the last time I crossed my legs.
Wow.
And she said, I'm crossing my legs now because I can.
I'm showing off.
Yeah. And sometimes it's these things from an outsider looking in. It seems like a small thing, but they aren't really any small things.
And I'm glad, Dr. Rich, that you're able to help people understand the fact that it is a disease, because you wouldn't look in the mirror and go, I have cancer. What a horrible person I am. I brought this on myself. I should just hide away because I have cancer and not treat it.
That's exactly right.
Yeah.
And I tell people too, I say, if you went to your doctor and they took your blood pressure and they said, you have high blood pressure, but we're not going to treat it, well, you'd probably find another doctor. Hopefully you would.
Yes.
Because things that are treatable. But I think we get the mindset, people will go on multiple diets. They'll have some limited success. Then they'll sort of fall off the wagon, they'll go back to their old habits, and then they'll gain the weight back, and they'll do this yo-yo dieting and losing weight and gaining weight and probably even gaining more.
Yeah.
And they start to feel like, well, I guess this is just my lot in life. And so they settle.
Yeah.
And that's one reason why it's sort of St. Thomas and Ascension have ministries. This is almost, I look at this as a ministry, being able to get people in a position to where they can feel better, enjoy life, have a longer life, and know that it's available.
So let's talk about what is available through, and the reason we're bringing in Ascension St. Thomas is because this is where you can get help from Dr. Rich. There's a whole team. Like if you were to go there and think, well, I would like to check into bariatric surgery, what does that mean exactly, first of all?
Bariatric surgery is just weight loss surgery.
Okay.
Bariatrics is sort of the field of weight loss. The folks that work in the bariatric center, all of them are previous weight loss surgery patients.
Oh, wow.
And so they know the ins and outs, and they know what that person that is calling is thinking, and the questions that they might have because they have actually experienced it.
Well, that's helpful.
So a patient will contact the bariatric center, and then they will get their information. They'll look at their insurance, ensure that they have weight loss surgery coverage, and they will navigate them through the entire process.
Wow.
There are certain things that insurance companies require. They require consultation with a surgeon. They require consultation with a dietitian. They also require a psychological evaluation, and that's mainly, sometimes that kind of scares people because they're like,
Sure.
I'm never into a psychologist. I don't know what they're looking at, see if I'm crazy or that sort of thing. But really, it's a matter of doing a psychological evaluation to make sure that people know kind of what they're getting into, and also to make sure that they don't have any eating disorders that the surgery will not help, and also so that those could, if they are present, that they could be addressed.
Mm-hmm. Because that might help resolve the issue or get closer to resolving the issue?
I don't profess for surgery to cure everything.
Yeah.
And if people have an underlying psychological issue with an eating disorder, then surgery is not going to help that. So that needs to be addressed.
I learned about childhood trauma in the past couple of years now and realized that that's part of my history, part of my makeup, and it affects how I react to things. It affects a whole lot of my life now that I didn't realize. And so I would guess that part of that would be talking to someone who can help you get to the underlying issues. And then do they guide us to treatment. You have behavioral health experts and nutritionists and things like that. We might get put someplace other than what we expected at first.
Yeah, and after the psychological evaluation, the psychologist will kind of review things and make recommendations, or continued therapy and that sort of thing. And sometimes people will come and they'll say, I realize that I need help, and even continue their psychological therapy during their recovery and for the rest of their lives.
Wow.
And I think that there's the physical part of the weight loss surgery. That's the surgery itself. But then that's truly the easy part. The psychological part is what we carry for the rest of our lives. And so when someone tells me that they have a therapist and and they regularly go and visit with their therapist, then I applaud that wholeheartedly, because that individual understands, hey, I can't do this alone.
True.
A lot of times we want to carry a burden all by ourselves. We can't do that. And that's one of the beauties of having the Bariatric Center, because we have support groups. We have the ladies in the Bariatric Center that can guide people. We have the dietitian in our office, and then the surgeon. And then, we can accomplish a lot more with help if we'll just sort of be open to accepting the help that's available.
So it's like if you have cancer, just surgery is not the only option. You have to have possibly other treatments, medicinal treatments, supportive systems, all of that. And we need to do that with obesity, and not just say, well, I've had the surgery, I'm good, I'm going to go on.
There are some of my colleagues that think, well, if someone has a bariatric surgery or weight loss surgery and they can make it 5 years with keeping their weight off, they think, I've heard some say, well, they're cured. I do not believe that there's a cure. I believe that we can put certain disease processes in remission.
Oh.
And I liken it to a cancer that's treatable. You can put it in remission with treatment, but you have to continue the treatment to continue to keep it in remission.
Whoa.
And I think that that's the best analogy as far as, weight loss and weight loss surgery. There has to be a change, and there has to be continued treatment.
And I think a lot of people are afraid it's going to mean a lifestyle change. They're like, oh, crap, I've tried that before and I can't do it.
And I think that's one of the beauties of having the support groups, being open to input from people that know what they're talking about, like the dietitian.
Yes.
And, I think staying engaged is the key.
Yeah.
So when individuals have a weight loss surgery at our center, we follow them. They have follow-up appointments for at least 5 years. The first couple of years is a little bit more intensive. We see them 2 weeks after surgery, 2 months, 6 months, 1 year, 18 months, 2 years. And then as long as they're doing fine, we'll go to annually.
Yeah.
The 5-year mark is what we want people to at least do.
Yes.
But I have people that are 9 and 10 years out from their surgery, and they still come back to see us. So
to stay engaged?
To stay engaged.
Or to say to tell you. Both, probably.
And, sometimes I after 5 years, I'll tell folks, you don't have to come back if you don't want to. I would love to have you come back in a year.
Yeah.
You can get your annual laboratories done.
Yeah.
Looking at vitamin levels and, that sort of thing. I truly don't know if I'm treating you or if I'm treating me. Because I'm being a little bit selfish, because I care how people are doing. Sometimes people kind of fall off the wagon and they'll quit coming back to see us after a couple of years. Yeah. And I often think, it's like, well, they either did really well, and so they think that they don't need to come back and see me, or they haven't done very well, and they're ashamed of that.
Yeah.
I tell people, you just need to check your emotions at the door, because we're all on the same team. We all want the same thing. Sometimes people say, well, I thought about not coming back to see you because my weight loss stalled out, or I might have gained 10 pounds and that sort of thing. And I say, well, I'm glad you came, because we can't help you if you don't come.
Yeah.
And we're not going to be judgmental. The past is the past. If you've gained 10 pounds, you can't go back and change that.
Nope.
Only thing that we can change is from this moment forward. And that's what we have to keep our mind on, the long-term goal.
So, and using the cancer analogy again, it's like if the cancers come back, you don't shame yourself and go, oh, no, now I can't show my face. You go back into the treatment and you go back and connect with the things that can help you keep it in remission.
That's exactly right.
If you're just joining us, we're talking to Dr. Stephen Rich from Ascension St. Thomas and the Bariatric Center. What else have you seen people trying to deal with on their own with regards to kind of self-treatment, either diets or things like that, or the new injections that seem to be a huge, huge fad right now? You see people dealing with that, or is that something that is prescribed sometimes for their weight loss?
Yeah, sometimes. We have partnered with a group that does the medical weight loss. Mm-hmm. And so, they will evaluate people and see about if they are candidates for weight loss injections and sort of guide them through that. Mm-hmm. There's been a lot of information come out here in the last 2 or 3 years with the weight loss injections for medical weight loss. And, people ask me, say, well, what is best for me? Well, that's an individual determination. Mm-hmm. Surgery is not for everyone. I tell people, if you can achieve the weight loss that you want to achieve and maintain that weight loss long term, then you do not need a surgery. And that's coming from a surgeon. This is what I do.
Yeah.
But I think a surgery is the last resort.
Yeah, you're not making marks on the bedposts.
That's exactly right.
Okay.
But the truth of the matter is, sheer dietary weight loss, just changing the diet, going on the latest fad diet, most of the diets are somewhat similar. It's almost one of the, and they're marketed and that sort of thing, and people want to jump on the next greatest, best. They're looking for the magic bullet.
Very restrictive. You can't do this, you can't do that, you can't do that.
That's exactly right. But with any mode of weight loss, I think that people are not accepting the fact that they have to change something.
Oh, I don't like that.
Nobody likes that. But it's one of those things, if we can just kind of stop and look at the big picture. I've heard the old saying, the definition of insanity is doing the same thing over and over again and expecting a different result.
Right.
I think that obesity is a progressive, lifelong disease.
Progressive.
That has to have treatment long term. And I don't think there's no magic bullet out there. There's something that we have to do in order to make sure that we're doing this long term.
I have a family member who had bariatric surgery, and he lost a lot of weight. But then he started, because his habits had not changed, and he has an issue with food, he gained a lot of weight back. But he would power through like a little bit at a time, and then he'd feel sick, and then he'd put some more food in there, and until finally he gained back a lot of weight. And then the next step was to start the injections. And he's still not able to change those patterns with food. Is it addiction part of obesity, part of the disease of obesity?
And I don't mean this in a bad way, but it's a psychological issue. Sometimes people don't really want to come to terms with that either. But until we come to terms with that, then, people eat for different reasons. Sometimes people eat because they're hungry. Sometimes people eat because, here in the South, they're just a big old boy and they eat a lot. Mm-hmm. But sometimes people are trying to find something. They're using food as a comfort, and that's their go-to if they're nervous, or if they're bored, or if they're depressed, and then it's something that they turn to. It's a crutch for them.
We're trying to fill a need.
That's exactly right.
Fill a hole with a brownie. That's
exactly right. And that's one of the things too. After weight loss surgery, I think people sometimes, we educate them on this, but sometimes what you have to be careful of, now that you've kicked the food addiction, is there some other addiction that's going to pick up, like, alcohol or something like that?
Right.
Because there is a higher incidence of alcoholism in people that have had weight loss surgery, because they're seeking something for comfort.
Yes, they still have that kind of addictive personality, And you can't just take something out because it's just, there's a void.
That's right.
Take that addiction away and there's nothing to fill it.
That's right.
If you still have that addictive type personality.
That's right.
Whoa. I see that in my family member. I see where something else has kicked in.
Yeah.
And it's excessive spending, like above and beyond what they can handle. But now it's compounded by the food issues still.
Right.
Because that's come back. So if you're not staying connected after you have bariatric surgery or lose the weight some other way, that's where you can kind of flounder on your own.
I think that's exactly right. And that's one of the things that I really talk about a lot is staying engaged.
Engaged, yes.
Being willing to accept help. You know, sometimes everybody's personality is a little bit different. You know, some people keep their cards close to their vest and they really don't want to share a lot with other folks and that sort of thing. But I think really just being able to look in the mirror and be honest with who's looking back at you, I think that is the key, because we can't blame what's happening on anyone else. The choices that we make, food choices, that sort of thing, we really can't blame those on anybody else.
Wow.
And you know, I think our society as a whole, not to get off on a tangent, but society as a whole, we want to blame somebody.
Oh, yeah.
You know, it's somebody else's problem.
Yeah.
I look at it a little bit differently. I tell people, once, you know, you have made the decision to make a long-term change, have the surgery, or lose weight in whatever way, then you have to own it. The success is yours. And this is coming from a surgeon. You know, my wife can tell you, with my surgeon hat on, I like to be in control. And so, because I feel like I'm the one that can do it the best.
Yes.
But I have to accept the victories, just like if I have to accept if something could have been done differently. Well, it's on me. But I think it's good to accept the victories too.
Yeah.
And who is responsible for the victories. So who's looking back at you in the mirror is the one that's in control.
Wow. That was a beautiful way to put that, because when you look in the mirror and you go, this is the person that's in control, if it's in your control, you can change it. But if it's somebody else's fault, you can't change it.
That's exactly right. And we control what we can control.
Whoa.
Just like, you know, with my children, I've told them, you know, they'll say so-and-so was doing this or doing that. I said, you know, you can't control them. Mm-mm. The only thing you can control is you. You can control how you react to that. And it's a similar type situation.
Yeah.
I'll have patients that come and they have excellent weight loss. They feel better. They're healthier. They've gotten off their 23 medications that they were on.
Oh, yeah.
All these things. And at the end of the conversation in their follow-up visit, they'll want to say, well, I just want to thank you. And I invariably tell them, do not thank me, because I'm not the one you need to thank yourself. They go, well, you know, I go, no, you have to own it. You have to own your own success. And they say, well, I couldn't have done it without the surgery. And I say, okay, I'll take that part. But that truly was the easy part. Mm-hmm. The part that you're doing is the hard part. And I think until we own our failures, we have to own our successes too.
I think that's hard for people as well.
It is very hard, because a lot of times it's easy to beat up on yourself. You know?
Heck yeah.
There are some people out there that, you know, they will accept their successes and more.
Yeah. I know.
But I think most of us, you know, we're a little bit more humble than that.
Mm-hmm. And sometimes false humility.
That's exactly.
You don't want to be prideful, you know, and we have an environment possibly where if we are proud of an achievement that we've done, it triggers other people's jealousies and it makes them try and kind of minimize that, and you buy into that. And
That's
so
right.
Here I am, an adult, and I can't take credit for my successes.
That's right.
Whoa.
But people would be quick to point out your failures.
Oh,
you know?
yes.
But, you know, I think a lot of it has to do with how we're reared, you know, and how we're raised. Because I was raised not to brag.
Yeah.
You know?
Yeah.
Well, there's some things, I mean, if you have weight loss surgery, you've lost 150 pounds, you've changed your life, I think you have a right to brag about that, you know?
You know, you just made me think, and I hope you're okay for me to veer off a little bit like this. It's
Sure.
kind of like, don't put your light under a bushel. If you did something great and it's a strength and can be an inspiration to somebody else, you should let it shine.
That's exactly right. We live in a society, and we're social people, and people are watching us.
Yeah.
You know, And I've had many patients say that, at work or something like that, people start losing weight, and then, they don't realize that people are watching them.
Yeah.
And then, after a while, people will come up to them and say, how did you lose that weight?
Yeah.
Or even in our own households. I'll have some patients that have smaller children, and, they'll kind of change the way the whole household eats, sort of awareness to our food choices.
Oh my gosh.
And they say that, sometimes their children will come and says, well, Mommy, how many carbs does that have in it?
Oh my gosh.
Or Mommy, should you be eating that because that might have too many carbs and that sort of thing.
Great.
So it really has put it on their radar. And I've had a lot of parents say, well, maybe if we can change the way the household approaches food, that my children might not have to do the extreme like I have. We affect people around us, even if we don't know that we're affecting them.
If you're just joining us, I'm Anna Marie, and this is Focus, and we're talking with Dr. Stephen Rich, and we're just almost out of time. But I want to ask you, just get a little bit personal. When you go home at night and you've helped somebody get on that path, they've chosen to use you as a method, a tool, a help to get on the path of being healthy, getting off the drugs, maybe changing the entire family's trajectory. How do you feel?
I tell you, I guess I fall into that category too. Sometimes when people, when I tell them you need to own this and that sort of thing, and I have a hard time owning the ability to see that some good has been done here.
Mm-hmm.
But I can tell you, there are patients that I've had that just really inspired me. Once a year, we have what we call the Bariatric celebration. And it's a night where people that have had surgery in the past, or even people that are looking forward to having surgery, can congregate. And, we have sort of a red carpet, and, it's completely voluntary, but people can tell their story and their weight loss journey. And I tell you, it's very, very humbling to be able to sit through that and see how people have absolutely changed their lives.
You ever get teary-eyed?
Oh, definitely. Because it really, sometimes we get busy, and you don't really, doing a job like this and being a surgeon, that sort of thing, you sort of get busy and doing caught up in what you're doing, and don't really kind of see the big picture a lot. But it is an opportunity to think, man, these people are very inspirational. They have grasped their own lives and changed it, because we all make choices. Sometimes when we don't make a choice, that's a choice.
It is.
And so you can either continue to go along the path that you're on, which is not a good path, or you can choose to make a big change.
Mm-hmm.
And both of them are choices. Both of them are hard. I've had patients say, both of them are hard. Doing nothing is hard. Doing something is hard.
Mm-hmm.
But if I choose the surgery route and choose to change my life, even though it's hard, I'll pick that hard because of the results that can come from that. To be able to change your life, to be able to get off the medications, be able to really just enjoy life and feel better.
Mm-hmm.
And truth of the matter is, those with diabetes, the studies show that after a weight loss surgery and doing what you're supposed to do, it can extend your life by an average of about 10 years.
Wow.
So it's not just extending your life either. It's extending a better quality of life. We all make choices, but, even sometimes people come and they're younger. Their family has a long history of type 2 diabetes and heart disease and that sort of thing. And some people have the maturity to be able to make the determination on the front end, I don't want to go down that road.
Whoa, yeah.
And so instead of having to put disease processes in remission, like high blood pressure and diabetes, that might have already started to have an effect on the body, then they can nip it in the bud before it gets to the point to where it has an effect on their body. And I think that the most important thing for people to know about weight loss, period, it's going to take a change. Even though it's not easy, sometimes we have to break it down, get past small periods of time. One of them said that they were given the advice, if you want to quit, always quit tomorrow.
Oh, yes.
So that means we never quit.
Oh, that was a beautiful way to wrap this up. Dr. Stephen Rich, bariatric surgeon at Ascension St. Thomas. And we're going to post some links for more information if you'd like to find out more on our Focus Facebook page. Thank you for joining us. Make sure you join us again next week. I'm Anna Marie, and that's Focus.